Hello, this is Tova Bergston, an MD PhD student at the University of Illinois at Chicago College of Medicine. This video is part of our Survivors Advising Scientists educational program, a bidirectional educational platform meant to connect our communities and increase scientific literacy and engagement. Our goal is to bring everyone to the table for scientific discussions related to cancer science and therapies. This is video number 7, Types of Clinical Studies. The first type of study we're going to discuss are experimental studies. These are studies with independent variables that are administered by doctors or scientists. Controlled experimental studies have both an experimental and a control group. Consider the example where a new drug is being examined for its ability to treat cancer. The experimental group would be patients receiving the new drug, while the control group would be patients only receiving the standard of care in the field. In this example, the study is comparing the experimental treatment to the standard treatment to see if the experimental treatment is better at treating cancer. Another type of study are observational studies, which are studies without treatments given by doctors or scientists. If a study has two groups and compares the outcomes between these two, then it is called an analytical study. If a study does not have two groups, then it is called a descriptive study. Descriptive studies are observational studies without treatment and without control groups. A good example of a descriptive study is a case report, which typically describes a single patient case. These are often used educationally to explain a unique aspect of the disease course, or a successful response to a new diagnostic technique, or a new treatment in order to educate physicians. Analytical studies are observational studies without treatment imposed by doctors or scientists and include controlled groups. There are several types which we'll go through now. Prospective studies move from a current starting point forward in time. For example, observing patients who smoke and who do not smoke in order to analyze their development of lung cancer. In this example, researchers would enroll patients on day 0 and observe them into the future to see if the smokers develop lung cancer more or less than non-smokers. This is an observational study because researchers are simply observing what happens to patients based on their activities, and they are not administering any treatment. Retrospective studies are similar, except they start at a point in the past and look forward in time. For example, observing patients who smoke and who do not smoke in order to analyze their development of lung cancer. But this time, researchers choose patients who were brought into the clinic in the past and follow them into the future to see if smokers develop cancer more or less frequently than non-smokers. This is still an observational study because researchers are not administering a treatment, but it's considered retrospective since researchers chose patients from the past and followed up with them into the future. Case control studies are another type of analytical observational study. In case control studies, researchers choose two groups of patients and observe their exposure to possible contributing factors. The two groups include cases, or those with a disease of interest, and controls, or those without the disease of interest that have similar demographics to those of the cases. Then, researchers look for any sign of exposure to a potential contributing factor in every patient in order to compare the relationship between exposure and development of disease. Let's look at an example. In this study, researchers choose patients with and without lung cancer and then compare their exposure to possible contributing factors like smoking. Another type of analytical observational study is the cohort study. In cohort studies, researchers choose a group of patients and observe their exposure to a desired contributing factor, and then analyze the development of disease. Let's look at an example. In this study, a small group of the patients in a hospital are chosen. Once the patients are chosen, their exposure to a contributing factor, in this example, asbestos, is recorded, and patients are separated into two groups, exposed and not exposed. Then, the patients are further separated into those with lung cancer, the cases, and those without lung cancer, the non-cases. In this study, the development of lung cancer is compared between these two groups in order to measure the relationship of the exposure to asbestos and the outcome of lung cancer. The last type of study we'll cover is the meta-analysis. Meta-analyses look at many different studies and combine their results for further analysis. This is a useful thing for researchers to do because a drug might show one effect in a single paper with a few hundred patients. But when researchers combine many studies that may include a few thousand patients altogether, the actual effect of the drug becomes more apparent. Now, we'd like to go through some questions that you can think of when you're reading clinical trials or clinical study reports. What type of study was done? Was the study experimental or observational? So was a treatment administered or not? What is the study looking for? Is it looking for exposure or disease development or both? If it's looking for both, what did the researchers look for first? What was the goal of the study? This is the end of Module 7. Now, the presenters would like to thank Dr. Kitaevsky and the administrative staff of the University of Illinois Cancer Center for their support in this effort. Additionally, we'd like to give a special thank you to all the cancer patient advocates who provided feedback during the development of these modules. We'd also like to thank you for reviewing this module, and we invite you to send any feedback on this module or suggestions for future content. Please feel free to move on to the next module, number 8, on study bias and randomization. Thanks again.